Hello guys, you're welcome to Audacious Med Hub. Today we'll be talking about histopathology, and the topic is Introduction to Hemodynamics. Essentially, we'll be introducing hemodynamics disorder. So there will be we're going to create a playlist. So there will be subsequent videos. This is just an introductory video. There will be subsequent videos to explain some um, some concepts under hemodynamics. So the health of cells and tissue depends on the circulation of blood, which delivers nutrients and oxygen and removes waste generated by cellular metabolism. The circulation of blood depends on the normal working of the cardiovascular system, which include the heart, the blood vessel, the blood, and as well as the blood vessel. Under normal condition, as blood passes through capillary beds, proteins in the plasma are retained within the vasculature, and there is little net movement of water and electrolytes into the tissue. To maintain the intravascular and extravascular volumes, the body must maintain both hydrostatic pressure as well as osmotic pressure. This balance is often distributed by pathologic conditions that alter endothelial function, increase vascular hydrostatic pressure, or decrease plasma protein content, all of which leads to loss of fluid hemostasis. This disturbance can lead to significant pathological conditions such as edema, hemorrhage, thrombosis, embolism, shock, which impact tissue perfusion and organ function. Essentially, what this page is saying is when the what this page is saying is when there's a disturbance, when there's the balance, when there's a disturbance in the balance between um, hydrostatic pressure as well as oncotic pressure, when there's a distortion of the balance between the hydrostatic pressure and oncotic pressure, it could lead to uh, pathologic conditions, right? That alter endothelial function, vascular hydrostatic pressure, as well as plasma protein content, all of which leads to loss of fluid hemostasis. So, a distortion in any of these things, endothelial function, vascular hydrostatic pressure, plasma protein content, a distortion of any of these things will lead to a loss of fluid hemostasis, right? Yeah, it will lead to loss of fluid hemostasis. Now, by the time we go further into the playlist, you will understand this concept better. Now, this disturbance can lead to significant pathological conditions such as edema, hemorrhage. We've said this. Now, now um, definitions proper hemodynamic disorder are disorders of the flow and distribution of blood and other body fluids within the body. They are common in medical practice with significant implications for patient outcomes. Conditions that cause perturbation in cardiovascular, renal, or hepatic functions are often marked with accumulation of fluids in tissue, edema, or body cavities. That's effusion. So, accumulation of fluids in tissue is known as edema, and accumulation of fluid in body cavity known as effusion. So, uh, factors affecting factors affecting the balance across capillary wall. So this is atrial end, this is the venous end. Now within the blood vessel, the fluid within the blood, of course, blood is the fluid within the blood vessel, is exerting hydrostatic pressure, right, which is this outward force, while the extracellular space, which contains plasma coating, uh, yeah, plasma proteins, is exerting plasma colloidal osmotic pressure on the vessel. So there has to be a balance between these forces to maintain fluid within the blood vessel. When there is distortion in this balance, fluid either leaks out or comes in, depending on the net pressure, right? So that's just that. Now, major hemodynamic disorders. include edema, effusion. Edema is the accumulation of fluid within tissue. Effusion is the accumulation of fluid within cavities. Hyperemia and congestion. Thromboembolic disorders, embolism and infarction. Hemorrhagic disorders, petechiae, purpura, ecchymosis, hematoma, shock. Thank you for listening. Please, if you haven't subscribed to this channel, kindly do so. Thank you.